Diabetes Free South Carolina is a new organization which is committed to serving everyone in South Carolina with a particular focus on underserved minorities who bear the brunt of the diabetes pandemic. So we aim to have a geographic statewide effect within South Carolina. Blue Cross Blue Shield and the Blue Cross Foundation came forward with a truly visionary idea and willingness to invest in the long term over years and decades. We have partner organizations that we work with to promote the program, and we have partner organizations that we're providing funding to. We've got 15 significant funded programs in doing something to turn around the diabetes pandemic in our state.
Gestational diabetes is so rampant everywhere, but particularly here in South Carolina, and it leads to such a high rate of diabetes later in life. The MOMS program is literally a multi-specialty approach at taking care of pregnant moms with diabetes in conjunction with a team of endocrinologists, dietitians, educators. We include ultrasonography in the care of these patients on site and retinal exams to rule out retinopathy and refer those patients as needed.
Our funding from Diabetes Free SC allows us to provide this collaborative care in our clinic that also seeks to address the needs of our patients, whether that's transportation barriers, access to food, access to mental health.
And we're heavily emphasizing funding many different disciplines with a focus on young people, children, pregnant women, because we all know early intervention sets the scene for the rest of life.
The MOMS program is a group of doctors that help with high-risk pregnancies, diabetes, and they work together as a group. The best thing I like about the program is just how they make me feel. They make you feel very welcome. It wasn't overwhelming, and I felt important because I'm getting a lot more help. My family history is very deep with diabetes. My father had it all his life, and my mother has type 2 diabetes. Before I got here, I had to go through different doctors, and then afterwards, once I got here, they're pinpointing exactly what I need. I'm very grateful that I'm here now. I felt like everybody cared about me and my child and what was going on.
Diabetes Free SC is integral to the MOMS program. They're our funding source for our MOMS program, and without them, we would definitely not be able to provide the resources that we're able to give our patients. Our primary goal with MOMS is to reduce health disparity and really meet our patients where they are, because these women have a lot of complicating factors, that affect their pregnancy. And they have to be seen often. So, if each of these women were previously having to go to an appointment once a week or every other week with all of these different providers, it's hard to work. It's hard to find childcare. It's hard to afford all of those copays. So if we can consolidate that into one visit for them, it's hopefully reducing some of the burden.
FoodShare is an organization that is also funded by Diabetes Free South Carolina, and it provides freshly grown produce to people who have food insecurities. We purchase these FoodShare boxes and provide it for our diabetic patients who do have food insecurities during their pregnancy. In our diabetic clinic, we have basically no no-shows. All of our patients that are appointed to come see us. And I think that it's because of the convenience. But the other thing is, I think we build relationships with these patients. They enjoy coming to see us, and they get everything done one-stop shopping. 9 out of 10 moms will do whatever it takes to have a healthy baby. And that's why this is such a critical time in a patient's life, because they're most motivated right now. And if we can teach them a way of life that is healthy for all of the future, that's when we really have an opportunity to make long-term lasting change.
With being pregnant and having diabetes, it's a lot more work. Since I've been here, my sugars have went down great. I started in January at 13 as an A1C, and now I'm at 6.9. So things started getting better than was before.
We've been very excited recently by new funding of 5 women's health initiatives scattered all over the state, which are intended to supplement our pregnancy programs by improving pre-pregnancy counseling and postpartum care, but more generally to address women's health issues, because we all know that women are the key determinants of health in any community and any family. And a new program for children's outdoor exercise, funding an organization called Kids in Talks. So we've got to have a pyramid of care where we have community health workers, large numbers working everywhere across the state, supported then by increasingly specialized people who can be deployed to look after the people that need to see them.
If you know you're diabetic, it's not something that's easy to change, but with a mind process and a different thought process, you can do it.